works for you. I like the ones that give me the best control over the shark. Okay, so I've drawn up some Lido. I'm just getting rid of my air bubbles. That one's being a pain. Make my sharp safe. Clean the area just with lighter duty antiseptic, and we're saying maybe alcohol or povidone or chlorhexidine. I'm coming in really shallow, and so I'm just going to position the arm. If you're going to use this technique, come in from the side. Don't try to do it like that. Okay? So I feel across. I say little poke, and then I advance the needle. The needle went across the top of the artery, not into the artery. I'm very shallow, and I keep my finger away. I aspirate with the plunger. I pull back on it. I did not get blood, so I know I'm in a good spot. And then I inject, and I just extend my finger and withdraw the needle, because that gives me good hand control over the shark. Okay? Watch what happens if you keep your finger over the artery. You could poke yourself, right? So that's a bad thing. I don't want you to do that. So again, one more time, little poke, very shallow approach, aspirate, and inject, and then withdraw. Okay? The other technique would be like this. Again, I'm starting with a clean hand. This is more like you're doing a puncture. I'm holding it at an angle. I feel the artery. I don't like going right on top. I go off to the side a little bit. So I'm not on top. I make sure I don't go into a tendon. I aspirate, and then I inject. I don't withdraw the needle at this point because I only have a subdermal application. Will likely create a wheel of Lido, which is like a little bubble, like if you got a vaccination. Okay. One more time on the other side, palpate with my finger, poke in just a few millimeters, aspirate, and inject. Okay. Make sure you pause on the aspiration to make sure you didn't get blood. Questions? That's good. Yeah, that's right. The one when I pulled the needle across, yeah. I push the needle in, check to see if I'm in an artery, because you don't want to inject into an artery. Then I inject and I withdraw. So the needle basically goes across, and it's depositing its lidocaine in the subcutaneous tissues over top and on either side of the artery. Now I'm going to cannulate. I'm just forming my cushion here so my hand doesn't roll, and I don't want it to do that diving board action. Okay. And I'll need somebody to give me a pulse. And the pulse I don't want a great big massive pulse. I just want a gentle couple finger. I don't want the arm going like this, right? So watch your slack on the pumper bulb. Okay. So I would have moved to a sterile technique. For this one, for today, if this is your first time, don't worry about the blue drape. You guys are probably good to use the drape if you want. You're ready for it. But normally I say don't use the drape till you've mastered the cannulation, the technique of handling the sharp. Okay? So we would have done that. What I should have done beforehand is check my guide wire. Make sure it's nice and smooth and it's not kinked. Know that when my guide wire is at the black increment, my guide wire is about to come out of the needle. Okay? So keep that fully retracted. Hang on with good control. I prefer, as opposed to the video, I prefer just starting with a low approach. That way, I don't need quite as finite hand control. The steeper I go, the more likely I am to go through the artery. The lower I am, the farther I go in before I hit the artery. Okay? I palpate. When I palpate, I'm keeping the sharp away from my hand. I'm going up, down, back, and forth like that. Up, down, back, and forth till I really know where the artery is. And I ask myself, am I on the artery? And I think of it like playing pool. Pool cue to cue ball to the 8 ball to the pocket. So I'm, kind of check it along a straight line. is multiple points. If I can't feel, I go back and forth like that. The most sensitive part of my finger is right in front of the nail bed. I put my nail on one side of the artery so my fingertip feels the pulse. I don't like to go like that because when I do, I can't really tell where the artery is. And you don't push hard. It's actually just light contact. So I palpate, I know where it is, I take the needle, I line it up with the artery, drop the needle on the skin, I rest, just waiting, am I really on the artery? And then I go, okay, I poke, I just get the bevel in with a direct, firm, direct movement. Note, I'm starting with a low angle so I don't have to go in and drop the angle. Alex is being an incredible cheapskate for pressure. He's testing my resolve, but that's okay, Alex. I am that good. Okay. Then I slowly advance. I wait for a flash. I got a flash. Now my needle tip is just in the artery. The catheter is on the outside of the artery. So I pause, then I go in another couple millimeters. Okay, I'm going to get you to stop just so I don't get all bloody. Then, now, that's the only time I take my finger off the pulse where I'm palpating it. I check my guide wire. My guide wire went in easy. The only place I can be is in the artery. There's no other hollow structure in the arm that you can put it in. Then I anchor this. I take a firm grip because I really don't want the needle to go forward. Okay, so I anchor this. My guide wire's out. I grasp my catheter, and it should slide in. A little bit of friction, but it goes in pretty easy. Then I palpate, I tamponade. I pull this out, and I drop it in the tray. I don't retract the guide wire, then pull it out. Alex, give me a victory squirt. Okay, there we go. So I think we have to charge up the arm again. It's a little cheap on blood right now. I'm in the artery. Then I grab this bad boy. My ramp valve's open. Everything's good. And, oops, somebody turned off the stopcock. I grab this and make sure, and I didn't pump it up, so I'm just getting gravity feed, so I was silly there. I didn't check that beforehand. I take my lobster claw. This is my lobster claw. My lobster claw grabs this, and I drop that. Then I grasp the end of the catheter. Just put a little pressure on the bulb. No, just no pumping, just pressure, right? Because blood should be coming out. I make sure I have a saline meniscus here. So there should be a saline drop there. I counter turn it, hanging onto the catheter, not to twist it, and then gently rotate it on. If I just twist it on, the stiffness of the tubing tends to rotate the catheter and can twist it. Then I go fast flush 1, 2, 3, fast flush 1, 2, 3. Fast flush 1, 2, 3. I shouldn't be shooting air into the patient. Should have been saline and primed beforehand. But I need to get the blood out of the catheter at that point. And that's because you need a continuous saline column from the blood or artery up to the transducer to give you that pressure. I should have stripped this off earlier. I make sure that the patient's not moving around. I would have held that in place. Tegaderm works better than tape. Tape is silly to use, but it's all I've got. It's all Heather bought. That's what we have to use. I would use 2 pieces. I'm going to use the first piece like this. Bring it on. I make sure my catheter's straight. I don't want it kinked. And I adhere the tape to the catheter. I kind of turn the top piece down. Top piece is going to go down. I'm going to turn this one up. Just keep him out of the way. And I adhere him on like that. I make like a V. Okay. And then I adhere the other side. I turn him down, making sure my catheter is nice and straight. And finish off my V. And then I could take another piece of tape and connect that. And that's sort of how it would go. I put a little longer tubing there so my stopcock's up here somewhere. Okay? There you go.
So, like, if you wrap around the thumb,